welcome to Cafdil Television, and this is Cafdil Healthcare. And today on Cafdil Healthcare, we are discussing breast cancer. Breast cancer is not new to most of us, and it is also imperative that even though it is not new, we have to always talk about it for you to also know or be known that it is something that can affect especially the ladies if you don't take good care of your breasts, as the name implies. My name is Kojo Arthur, and I'm hoping that you would also follow us on Facebook, that is Cafdil Cape Coast, and on YouTube, Cafdil EDU or Cafdil Edu. You follow us, share for your friends to also get the opportunity to watch this educative program. I've been joined in the studios by Chandi Ephraim. He is a public health nurse from Cape Coast Teaching Hospital. Chandi, you are welcome.
Thank you.
And also Lois Echampong, also a rotation midwife at Cape Coast Teaching Hospital. You are welcome, Lois.
Thank you.
You're looking so bright. Yeah. And like I said, we discussing, or we're going to talk about breast cancer. Even though we've heard breast cancer, I want you to, Chandi, reiterate what breast cancer is and what are the causes of this breast cancer that we always talk about.
Okay, so with breast cancer, when we say breast cancer, we are simply saying that it's a malignant tumor of the breast. So it's either affect the loops of the breast or the ducts of the breast. So when we say loops and ducts, we are simply saying that when you take the anatomy of the breast, we have various connections that will transport various things from other parts of the body to the breast. So for instance, milk like this is being produced at some point and being transported to the other point. So we are saying that when we have an abnormal growth and uncontrolled growth of cells around those particular sites, then we can say the person is having breast cancer.
And so what causes those abnormal growth around those areas that you're talking about?
So just as we said, with the growth, they can be caused by various problems. So for instance, we will have to get, some people are at risk of it, which we can talk about genetics, okay? So your genetic makeup, you can have some abnormal genetic makeups that will prone you to cancer. So when these ones are found around the lobes or the tubules or the ducts of the breast, then when the conditions are favorable for them, they can abnormally grow to cause breast cancer. We can also have smoking. People who smoke, women who smoke can also have or get breast cancer because we have some substances in the breast cancer that are known as the nicotine. And studies have shown that nicotine are actually cancer-causing agents. So if you have the kind of like genetics that we were talking about, or even if you don't have those genes in you, but you are somebody that excessively smoke, then you can develop this abnormal growth that will lead to this one. Then we can also say some people can inherit the genes of breast cancer. So if you have your mother or your grandmother in the house who might have developed breast cancer.
Is that the immediate family or extended family?
No, immediate family.
Immediate family.
Okay. Yes. So if and the immediate family, somebody had it, then it could have been a trace in the family. So it doesn't mean that once somebody might have had it, you will also get it.
Okay.
What is only telling you is that you have to be very careful, because if you get to the triggers, then you can easily develop it. So some of the triggers are just the smoking and overweight. Yes, overweight can also predispose somebody to breast cancer. So if you are there, then you allow yourself to grow abnormally big, then it can also predispose you, because fat itself predisposes your immune system to a lot of sicknesses. Yes, they also have people that might have done one or two things that will compromise their immune system. So we talk about smoking, as I mentioned earlier. We also talk about alcohol use. They also even talk about some use of pomades and some cosmetic surgeries and other stuff. They can
use of pomade.
Yes, we have some bleaching pomades that contain some chemicals that can trigger cancer cells to grow. Yes, so all these things, lifestyles that we also adapt, can also predispose us to getting cancer.
Oh, all right. So apart from what you've mentioned, are there any risk factors for developing, apart from what you've mentioned, and how can individuals assess their own risk?
Yeah, so the risks, as for the risks, we have various, just as I've mentioned. We have alcohol can risk you, lots of alcohol intake. For our women, it can risk them because we are talking about a situation where the cells are there. They are growing at their normal pace. But you do something to let them to overgrow. And when they start to overgrow, you can't control the overgrowth. So when you can't control the overgrowth, then that leads to the cancers we are talking about. So smoking, as I indicated, is a very bad risk. Then we also have abnormal weight gain. You know, we can all control our weight, and you know when you are growing abnormally and when you are not growing abnormally. And we can also all attest to the fact that there are a lot of body chemicals outside there. Body chemicals outside there, pomade and co that we use. You know, some people are there, they'll tell you that I have a small breast, I want it to be big. Somebody is selling big breast products. They will go and buy, they will apply on it, they will massage it. All these things contain chemicals that might be dangerous to trigger the cells to overgrow, to be cancerous.
All right. You made mention of smoking.
Yes.
I want to know.
Tobacco.
Okay, so tobacco is one. I'm referring to the fishmongers and stuff. That kind of smoke. Is it also a risk factor, or is the smoke type of, I mean, those who smoke tobacco and other?
Yeah, so the tobacco is the one that contains the nicotine. But so the nicotine is having a direct effect to triggering or causing cancers.
Right.
But with the monoxide from even cars and even the normal, what's the name? Ones that you are talking about,
the
those who smoke the
stuff,
fish.
The fish.
Yes, with those ones, what they do is that they can compromise the immune system. And once the immune system is being compromised, you are prone to getting any other medical condition, not just the breast cancer alone, but any other medical condition.
Right.
Once your immune system is compromised. So let's say under normal circumstance, the chemicals you were taking in wouldn't have caused any cancer in you. But because your immune system is now compromised, the least of the chemical could cause the highest of cancerous cells in you.
Let me bring in Lois. And Lois, what are the signs and symptoms of this breast cancer if someone is developing those things? What are some of the things that you're going to see?
Okay, when someone is developing breast cancer, the person might have redness on the breast. They must also get, they must feel some knots on the breast, or they will have breast dimpling. So this is the breast dimpling. Then you see that the nipple is pulling inside. This is the invention of the nipple. These are all signs that you see someone is getting a breast cancer. And when you feel your breast, you feel that there is something inside, a lump inside the breast. So these are the signs.
What about that small hole that you see?
That's the dimpling of the breast.
This one?
Yes, the small holes on the breast is the dimpling.
Oh, okay. So apart from this, what else are you going to see? What other symptoms are you going to see?
As I said, the invasion of the nipple. You see, this nipple is not erected. Normally, the nipple is supposed to be erected, but this one is pulling inside. So this is the other signs of. And then you see some sores on the breast.
Okay. So at what stage are you going to see this?
Oh, okay. When the cancer reaches the inflammatory state, that one, it appears, you see the sign, the sore and this thing on the breast.
So let me know. So what are the difference between the invasive and non-invasive breast cancer?
So with the non-invasive, the cancerous cells is on the breast tissue. So the invasive one, it has moved from the breast tissue and to the other parts of the body's organs. So not only the breast, so it has moved to the other parts of the body organs. So let's say this is the invasive one. So the cancer cells are not only on the breast tissue, but it has moved to the other parts of the body. Yes, but with the non-invasive one, the breast is on the, the cancer cell is on the breast tissues. Yes, please. So that's the difference.
So I've seen some stages of breast cancer. The first stage, 0 means what? With this is what?
With this one, the cancer cells has now developed. So this one, the person has 100% of surviving because they have now started develop. So if you detect it early, then they will do something about it, then you'll be free. So the stage 1, the cancer has begun to develop at the tubules. Yes. So it has. This is the cancer cell. The red patch is the cancer cell. So
okay.
It has.
So all the red ones we see there.
Please.
Okay.
Yes. So it has developed in the breast tubules.
Ah, okay. So cancer in breast tissue.
Yes.
Tumor is less than 1 inch across.
Yes.
In size.
Yes.
Oh, okay.
So this is the stage 2. So the tumor is less than 2 inches. So it's spread to the axillary lymph nodes. So it is not only in the tubule. So it has spread to the axillary lymph node. That one is at your armpit. So it has spread to the lymph nodes. So in this one too, you said the tumor is larger than 2 inches, and then the cancer spread to the axillary lymph node. So this stage is where you see the dimpling, the breast dimpling, and then the invasion of the nipple. But this is this stage. We see that the cancer cell has spread. And this one is the invasion. That one, the cancer has spread from the breast tissue, the breast lymph, and to the other body organs.
And this one has about 16% survival.
This one, the chance of survival is very low.
This is where, when you get to this stage, this is where your breast may be eliminated, right?
So it's this stage, they do only palliative management. So they will give you medication to take care of the pain, but curing the cancer or taking off the cancer cell is not possible. This one, when you take the breast off, the cancer is still in the system because it has traveled to the other parts of the body. Okay. So when you reach this stage, we only do the palliative management. So they will take care of only the pain.
All right. So you're watching Cafdil Healthcare here on Cafdil Television, and we're discussing breast cancer. And I know you're learning a lot on this, especially with the videos and stuff that, with the visuals that you are seeing. There are certain things that I've never seen before, and it is very scary, the way it's being arranged, very scary. And so all the ladies, you should be able to, especially I pray that nobody gets to stage 4, the stage 4, which is very, very important. So I pray that you don't get to that stage and you detect your destiny. Now, Chandi, let me come back to you. How important is regular screening of breast cancer, and what method are currently recommended?
Yes, the regular screening is very, very important. Just as you just said, we want to get people at stage 0. Stage 0 simply means that we've done the early detection, because with this kind of cancer, we don't have, let's say, prophylaxis, where we say go and take an injection so that you won't get it at all, even if you are prone or at risk. So what we say is that we don't want you to get to 0. So how will you not get to 0? You not get to 0 when you adopt a very good lifestyle, okay? And when you do the examination yourself, you don't necessarily have to wait till October before you go to the hospital for them to do it for you. You can do it yourself after every menses of yours. So every month when you have your menses, after the menses, then you will what? Do your self-breast examination. That's one. And the other thing is that most of our ladies, sorry to say, most of them don't know themselves very well. As a lady, you have to know yourself very well. You have to know yourself very well because it will give you a clue as to when things are going the wrong way. You can easily identify. So for instance, growing up through your secondary school education, you've been touching your breast after every menses. Then you realize that there's nothing in there. So at a point in time when something starts to develop in there, you will be quick enough to identify that something is happening in there. Then you could go to the hospital as early as possible. If it is a lump that has developed, then they can easily remove the lump to prevent you from getting the breast cancer. So we recommend that everybody should learn how to do the self-breast examination. Then it's only when you do the self-breast examination, then you experience something in it. Then when you go to the hospital, then they can now proceed to do the mammogram and all those things to find out if actually what you felt is a lump or is a different thing altogether. So what we do is that we encourage every woman or every lady to adapt the lifestyle of what? Breast examination.
Self-examination.
Yes, self-breast examination. Don't just wait till October. And don't say that your breast is too big for you alone to examine. You can do it. When you do the right thing, you can do it. You can also teach your husband how to do it so that he'll help you to do it. Don't also say your breast is too small. You will not do it. You can also do it. So the self-breast examination is very important way of us preventing ourselves from getting to the cancerous stages. It will help us to do the early detection, then we can.
All right. So in mentioning breast self-examination, Lois, what should women know about breast self-examination and how can they perform them effectively? What is the key word is effective. Effectively, how are they going to do it? Chinese said is anybody, any lady can do it. How can they do it effectively?
Okay. As my brother was saying, self-breast examination is very important and it helps in early detection of any lump. So as a woman, you should study yourself. You should know the normal from the abnormal. Then you should know how to perform this self-breast examination. So before, you have to stand in front of a mirror. Then you observe your breast. You see if there is any changes in the size and then the shape. Are your both breasts of the same size? Is one bigger than the other? Are the shape the same? Or one is falling, one is standing? Then you look at the skin of the breast. Is there any changes? Has there been any rashes on the breast or any change in color? Because the skin of your breast should be of the same as your skin, because it's also part of your skin. So it should be of the same texture and the same color. Then you should also look at the nipple, whether the nipple is pulling inside, which is the inversion of the nipple. Normally the nipple is supposed to be erected. It shouldn't be pulled inside. So you should look for all these signs to see. But if you don't know yourself or if you don't practice this thing, you won't know the normal from the abnormal. So it's very important as a lady, you should study yourself and know the normal from the abnormal.
So what do we have here?
So this is how we perform the breast self-examination. So the A is saying that you stand in front of a mirror, then you study your breast. Then the B is saying that you put your hand on your waist. So when you put your hand on your waist, you'll be able to see under your breast to see if there is anything also going on under your breast.
But some people's breast is very big in such a way that even if you put your hand, like you are saying, there's nothing that you are going to see under.
So you can use one hand to support it. That's why you are standing in front of a mirror. So when you lift it a bit, you will see the under.
But the two hands are there, so.
So when you use the other one and use the other one to lift, you see.
All right, that is a B.
Yes.
Okay.
So the C1, and the important thing is when you are starting the breast examination, you should apply soap or oil. It increases the sensitivity for you to detect if there is anything in the breast. So when you apply it, and when you are doing
any oil?
Body oil.
Okay. All right.
And when you are examining the left one, it should be done with the right hand. And when you examine the right hand, it should be done with the
direction.
left. Okay. Yes, please. So here, you put your hand at the back of your head. Then you begin to massage. You feel your breast. But we use the 3 middle fingers, the part of the 3 middle fingers, to feel the breast. You don't use the tip. If you use the tip to feel it, you feel that there is something in your breast, but there is nothing in your breast. So you use the part of your 3 middle fingers to feel it. So it's either you feel it in line or in circular manner. So let's take this one first. So if you want to use the line one.
So you were in C. So looking in the mirror, raise your arms and rest your hands behind your head.
Yes.
This allows you to see the underside of your breast. Then you come to the D. D, what is there?
So the D, you are feeling, you see the breast tissue begins from the collarbone down to the breastbone, under your arm and your armpit, and to where your sternum is, like the breastbone is, as I was saying. So this one, you have to feel if there is any enlarged lymph. We all have lymphs in all parts of our system. So you have to feel if there is, normally you don't have to feel any lymph nodes. So you have to massage and see if there is any lymph. There may be any inflammation which is enlarging the lymph nodes. So this one you have to feel the lymphs under your arm, at your collarbone.
You place your left hand on your waist, roll your shoulder forward, and reach into your and check for whatever. Hey.
Yes.
Then
that's why I have made it simple.
So simple. Okay.
So that's what I was saying. It's either you do it in line or in a circular manner. So let's take this one first. When you start from your collarbone or outer edge of your breast, then you move your finger towards your nipple. So you begin from the outer edge of your breast.
Top to down.
Then you move your finger towards the nipple. So you make sure that you do that to cover the entire breast. And while doing it, you don't have to lift your finger because you might miss some parts of the breast. Maybe that part is where the lymph is. You might not know.
Okay.
Yes. So when you cover the entire breast, then you press down the nipple to see if there is any discharges coming from it. Normally, when you are not pregnant, when you are not breastfeeding, you are not supposed to see any fluid or any discharge coming from your breast. So when you are not pregnant,
what about if you are menstruating?
That one, it varies, not everyone. Yes. So if you see any discharge, you can take cotton or white clean cloth to wipe the nipple and see if there is any discharge. Maybe the discharge might be small, you might not see it. So you should take any cotton or clean cloth, white one, so that if the discharge is not clear and is colored, you see the actual color of the discharge coming out. Then in a circular way too, the same thing, you start from the collarbone. That one you move around your breast. So start from the base of your breast, then you move towards your nipple. So you go in a circular way. That one you should make sure to cover the entire breast. So when you reach the nipple, you do the same thing.
Does that mean the breast is not what we see small, it extends?
Yes.
Oh, okay. All right.
So when you finish with the other one, you repeat the same procedure with the other one too. And you are not supposed to use your thumb and your index finger to press your nipple. That one too, you will feel like there is something in the breast. But because of the way you are pressing it. That's why we use the pad of our 3 middle fingers to feel it. And when you are feeling it, you should apply a little pressure. So when there is anything inside, you will feel it. You are not supposed to just rub your hand around it. Apply a little pressure. So you will see if there is something inside or there is nothing inside. So when you are feeling it too, you should look for a lump or any hard knots on the breast or any thickness of the breast.
Is it the same advice that you give to men when they are?
Yes, because men also have breast cancer. Yeah.
But it's not as rampant as yours.
Yes.
But I'm even talking about men who are trying to massage the breasts and stuff. Are they supposed to use this? Because
yes, you are supposed to use the pad to feel it. Like the same way applied to the woman.
I mean, when they are doing other things is what I'm talking about.
When they are doing other things.
Yes. Because, well, let's move on. Anyway, so let's come to the screening of this. Is there any advancement from, the normal when it comes to the screening of
Yes,
breast
so
cancer?
the screening, that's what we say, you know, in our practice, we have to move from one stage to the other. So the screening basically is the breast examination. Either you do it yourself or it's done at the facility. So it's after we feel something inside the breast, then it can inform us that we felt something. Now, what is that thing we felt? So when you now feel that thing, then you now go and do the scan. Then the scan will reveal for you whether it was a lump you actually felt or it was a different thing you felt. Whatever thing that you felt, if it can be removed, it will be removed. So generally, with the screening, you have to do the breast examination. So it's either you do the self-examination or you go to the hospital, then they will do the hospital examination. Just as we are in October, almost all the hospitals are doing the breast screening for free. You know, most of the times in our settings, when you hear screening, our idea is always about either sample or taking pictures.
Sure.
But even questions alone, questions too, in our setting, questions is also screening. When you go to hospital and they ask you, do you cough or do you feel pain in the breast? Do you feel discharge in the breast? Then they use and fill the form. It's also called screening. You understand?
Right.
So with the breast examination or the breast cancer, the best screening or the first line of screening is the breast examination, either by the doctor, the nurses, or you yourself. You can't just get up and go to the hospital and tell them that I'm coming to do breast scans, mammograph, or any other thing without basics. We'll take your history, we'll find out why you are, because mind you, every scan, every x-ray or every other thing also have a side effect on you.
All right.
So we also want to minimize it as much as we can. So the best is you self-examine or you go to the hospital.
You're still watching Cafdil Healthcare on Cafdil Television. And let me remind you that we need a sponsorship. So if you're a businessman and you want to sponsor us, the line to call is on your screen. You can call and talk to the authorities, especially if you want your product to be mentioned on our show. You know, our health is our wealth. It's very important that every week we come your way to discuss these health matters for you to be aware of certain things if we are ignoring them. I'm also hoping that you will continue to follow us on Facebook, that is Cafdil Cape Coast, and on YouTube, Cafdil EDU, Cafdil Edu. Then share for your friends to also get the opportunity. Let's come to the treatment options. What treatment options are available for people who are being diagnosed with this breast cancer? Let me come to you, Lois.
It's okay with the treatment. We have medication and then the surgery. So when the lump begins to develop, then you detect it early and send it to the hospital. They can give you a medication to stop everything. But when it's developed, they have to take the lump out. That is when it is only in the tubules or in the duct. That one, they will take the lump out. That's the lumpectomy. But when it spreads to the entire breast tissue, that one, they have to take the whole breast. That's the mastectomy. Then we have the palliative management.
So is that what we have here?
So this is the lumpectomy. So this one, they remove only the lump. And this one is the mastectomy. The entire breast is gone. We have a case whereby they take both breasts.
Hey.
Yes.
Yeah, where you feelings in alcohol? So when after lumpectomy, can it develop? Can it come back? Can the cancer come back again?
Yes, it's possible.
It's possible.
Yeah. So when you take the lump out from the breast, you have to send it to the laboratory for investigation to know whether it is just a tumor or it has become cancerous. Because the cancer can develop again. Yes.
It can develop. It can reoccur.
Yes.
Oh, okay. All right. All right.
Then we have the palliative management. That's when the cancer reaches its last stage. Now, when they remove it, still the cancer is still in the system. Oh. So they have to manage the pain.
That the first one you showed, the stage,
the last stage.
This one.
When it reaches this stage, you will only receive palliative treatment.
But do you have a situation like this?
Yes.
Where the person will sit down till it gets here?
Yes.
Hey.
So at this stage, just as you said, at that stage we will do the mastectomy. They can remove the breast, but the cancer have affected other parts of the body. So we just be doing the palliative care, giving you medications, okay. And even with the mastectomy, sometimes we have to do chemotherapies and things so that we'll be able to bring the cancer to a small stage before we go and remove the breast. All these ones are cost. That's why we are saying that don't wait till you get there. Let's do the prevention, which is always better than the cure. Because with breast cancer, it's only in October that you can get a free surgery to do. Just what if you develop it in November? That means you have to wait
till the following
year, 11 good months. By then, your money is going and you are reaching here. So we don't want to reach even 0, not to talk of 4. But these are the treatments. Either we go the medications to help you small with the medications, of which the chemotherapy is part of the medications, where you go to Kolebu almost once every month or so for them to go and use the machine to try to control the cancer so that it will not be spreading uncontrollably. So even though it's uncontrollably, but they are trying their best to control as much as they can. And it is a lot of money. Chemotherapy is not free. It's a lot of money. Yes.
All right. So are there some kind of support system for people who have been diagnosed with this cancer?
Yes. There are a lot of programs going on. These NGO donor-funded programs going on for people with breast cancers. Just as we are in this month, if you have the lump, they will do the surgeries for you. If you have the cancer, they will aid you with treatment because they've had donors and all those funding. So when it comes to our setting, what we do is that we try as much as possible to help you to reintegrate into society very well. Those people that they've done the mastectomy for them, if it is one breast, we encourage you that when you are wearing brazier, you pad the other brazier so that people will still see you with 2 breasts, but in effect you have 1 breast. If both breasts have been removed, we still encourage you to pad both your braziers so that you wear them and you go out your way. We encourage you to join groups of people with related conditions. So if anytime you go for reviews, you realize that you see other people that are also in for review. So we encourage them to make friends, form WhatsApp groups, social groups, so that anytime there are these donor fundings or these NGOs that come in to give aid to them, then we help them. Because health insurance doesn't cover the treatment of those things. The only one health insurance will cover is the palliative side, where we are giving you painkillers, we are giving you antibiotics and all those things. Health insurance will cover, but with the chemotherapy, health insurance will not cover it and any other thing. So with the hospital settings, the best we can do is what I've just told you. With the nursing side, we nurse it. If you have somebody with breast cancer, either the person can be coming to the hospital for daily dressings, or you can be visiting the person during your home visiting to dress for the person at home. You can serve painkillers whilst you'll be praying along with the person.
All right. Good to hear. But that is for hospital setting. Let's come to, because everyone has a family, we all have friends and stuff. And so I want to know how can this family, friends, support someone going through this cancer treatment?
Acceptance and support. So when we talk about support financially, very important, because as at that time, the treatment, some treatment might decide that where the cancer have reached, the chemotherapy can be like, do it every week, once every week, once every month. So if the person was a worker, the person will end up spending all his or her, the person will end up spending all her money on chemotherapy. So the family will have to support. And psychologically, the family will have to support the person to let the person still feel that nothing has changed. So if you are a man and your wife is undergoing such a problem, it doesn't mean that go out and bring another woman to the house to let her feel depressed. You have to support her. You have to support her. And you also have to understand her. This is not a time for you to be demanding to touch the breast because already she's in pain. When it happens that way, the breast is in pain. They can't even touch it. Very painful. So the man will have to support her psychologically, financially, the family, the extended family, the nuclear family. Everybody will have to come on board to support the person because once the person starts to feel dejected by family, depression alone can worsen the case of the therapy. So that is what we want from the family, most especially the husbands. Because when the cancer wasn't there, you were the one enjoying it. The children enjoyed it. Now that the cancer is there, the husband cannot enjoy it. The children might have finished enjoying it. So what do? You all have to also remember that once upon a time, we all enjoyed from this one. So let's all support the person so that the person will feel at home. So that brings us to most of the times when you see the rich versus the poor. When they get these cancers, the poor are the ones that suffer a lot because aside the financials not being there, the understanding of what they are going through is not there. But you see with the rich people, aside the finance being there, but they also still come together as a family to support the person, let the person feel at home, then the person will be good to go.
All right. Lois, you know, at the beginning of our conversation, Chandy made mention of kind of lifestyles that sometimes, trigger these cells and stuff. And so let me ask you that what lifestyle changes can individual make to reduce their risk of breast cancer?
Oh, okay. So as I was saying, studying of oneself is part. When you study yourself, you will see if there is anything going on with your body. Yes.
Is it always? Or
Okay.
anytime you are in front of your
when
mirror?
When you are in your puberty, you can do it 4 or 5 days after your menstrual period. And when you are in your menopause, you can take 1 date in every month, then you do it, you study yourself. So when you do it regularly, you know that something is going on or everything is okay with you. And we have some lifestyle like drinking, smoking, that reckless lifestyle.
But if you say drinking,
like drinking alcohol.
But drinking water is there.
Excessive.
Excessive drinking of alcohol.
All right. Okay.
And then the smoking, it also causes.
Yeah.
And we have some cosmetics that we use. It also triggers the growth of the abnormal cells. So we should know what we are applying on our skin. So the skin, we have some pores in our skin. Whatever we apply on the skin, it enters. So we should know what we are applying on our skin.
What about our? Let
me add up. Also, exercise is also very
exactly
important.
what I was going to ask about concerning the nutrition and exercise.
Yes. Exercise and nutrition.
Yes.
Good nutrition and good exercise.
Yes.
In fact, as part of the treatment of cancer, nutrition and exercise helps a lot.
Recovery.
With good nutrition, it will also help the other cells to also grow. It will also help your white blood cells, which are the defense mechanisms of the body, to also grow well, so that they will also be trying their possible best to suppress or control the extent to which the cells are growing. The exercise, you remember we established that those that have gained a lot of weight or excessive weight are also at risk of developing these cancers. So when you are able to exercise to burn enough of the fat, then you will also be in a good position to reduce the risk at which you will develop such a condition.
All right. Cafdil Health Care is what you are watching. Like I said, we are all learning a lot. You may have heard breast cancer and a lot, but today, education is exceptional. In fact, it's in-depth, actually in-depth. And I hope that you've learned a lot and you are not going to allow yourself to get to a certain age where your breast will will be, out. I mean, it will be dangerous. Your feelings and stuff will all go. I don't think you like it that way anyway. Now, I want to know whether this breast cancer has anything to do with our mental health.
Yes, in a way.
How?
It can lead to depression. And depression is a mental health condition, area of concern. It can lead to depression because your social integration can be affected. Family integration can be affected. You have a cancerous breast, which can be smelling. So it will prevent you from integrating with others outside. And that is depression. You have your breast being chopped off. You feel low self-esteem. You don't feel a woman anymore. In cases where the two breasts are cut off, you don't feel a woman anymore. So it can affect your mental health through depression. When you are depressed, then depression kills faster than even some of these conditions that we are talking about. Because at that point, nothing is okay with you again. So yes, breast cancer has an effect on our mental health. It's not a direct effect as to it will lead you to madness and this thing. But just as we are saying, it spreads. Cancer spread. So when we do the mastectomy, remove the breast, and it has still spread to other parts, and it is not well controlled, it will continue to spread.
To the rest of your body?
Yes. So with breast cancer, it has a lot to do on our mental health, most especially depression, social integration, family integration. We have some people, when they get this breast cancer, their husbands can even divorce them, separate, start bringing in women, doing all those kind of things. Then they get depressed. They can be suicidal. And all these ones are what? Mental health issues.
Wow. Would you have some? Our time is up.
Okay, the cancer cell can even move to your brain cells. And
cancer?
Yes, it can move to your brain cells. And when there is some abnormal growth in your brain, you have a lot of mental condition and mental issue. You become unstable, confused, and those kind of things. So apart from the depression, you can also have that kind of condition.
Anyway, so we are going. What advice would you give to our women, especially?
Okay. So as a woman, as I said, you should steady yourself. When you are in your menstrual cycle, you can do it 4-5 days after your menses, then you check if there is anything going on. If you are not sure of anything, then you report to the facility. So it's better for them to say everything is okay than they will say they are sorry. So you should steady yourself. If you don't understand anything, or if you are feeling that something is going on in your body, then you report it. Then you continue doing the breast self-examination.
Right. Prevention is better than cure.
Yes.
Shandy?
Yes, so I will talk to the men. If you are a married man, it's good you learn along with your wife, so that if your wife is not comfortable going to the hospital for others to do for her, and she's not also comfortable doing it herself, you the man, you could help her, so that when you the man, you do it. We have instances where men are able to help their wives. They come to the hospital, they are confirmed, and they ask you, but how did you know? Oh, it was my husband that told me that he felt something in my breast.
Husband, what we do?
Yeah, so we will encourage all men that if you can help your wife, help, because when it happens, your pocket will suffer. You're going to suffer it, because aside October, treatment is very expensive. So we have to help them. And also, if we have our wives and unfortunately they develop those conditions, we shouldn't abandon them. we should still stick and stay with them and support them.
Very important.
It's not contagious. Your wife cannot give the sickness to you. Your wife cannot give it directly to your children. It's not contagious. So you support them as much as you can, psychologically, physically, financially. You support them. That is what they will need when they are going through such problems.
All right, thank you so much. That is Chandi Ephraim. He is a public health nurse, and Lois Echampong, also rotation midwife of Cape Coast Teaching Hospital. Thanks so much for coming, and I hope and pray that, especially the ladies, you're not going to sit down for you to get to the last stage where your breast will be chopped off. I mean, it's going to be so sad. This is where time will allow us to be with you. Thanks for watching. Thanks to all the crew. My name is Kojo Arthur. Same time next week. God be with you.
Mojo